Workers' compensation cases do great with the right care. Here's how the right medical care clinic in Amarillo, Texas can make the difference for your injured workers. Hey everyone, I'm Dr. Jeff Williams with Creekstone right here in Amarillo, Texas, and I'm coming to you with a brand new video. This week we're talking about how Creekstone is now expanding and integrating medical care and treatment right here in our clinic. We're also talking about how Creekstone is uniquely positioned now to take the very best care of your injured workers, or specifically work comp patients. Times have changed through the years when it comes to pain care and the thinking around the topic. That's all thanks to pain research. Research that continues to come out literally every single month. All of the latest numbers make it clear that low back pain is the leading cause of disability globally and is more expensive to treat than common issues like heart disease and diabetes. When you think about the cost of treating heart disease and diabetes, well, that's a pretty significant statement, yeah? Not to mention that it puts the exclamation mark at the end of the sentence when we're describing the size of the issue. And not only that, but back pain and the treatment of back pain has not shown a track record of improving. In fact, it's just the opposite. It's getting worse. Think about it. People aren't out working and moving and getting fresh air and doing all that stuff. Now our life is more sedentary, sitting in front of computers and things of that nature. And so this really underpins the very reason that thinking is changing and research is being pumped out at a feverish pace and treatments are starting to really evolve. Slowly, but the treatment is evolving. There was a time when an injured worker was told to take some medication, go lay down and rest, and let the injury heal up. Now we know today that those recommendations are actually about 180 degrees from what an injured worker or patient of any kind should really be doing. Instead, the injured patient really should be moving and actively working to recover. The easiest way to demonstrate this is it's a simple analogy. Think about those that have surgery, appendectomies, C-sections, or maybe a patient has their gallbladder removed. The staff at the hospital has the patient up and walking the halls either that very day, but definitely by the next day. The basic premise here is that movement is healing. We just have to communicate with our injured patients the concept of hurt versus harm. When you're injured, well, some things just hurt, and that's typically okay. Keep doing it unless it feels harmful. Now, if it feels harmful, you might want to back away. Find your baseline that is comfortable for you, and then start there and increase 10% every week as long as it's not harmful until you're back to 100%. Here's a very unfair factoid I'm going to share with you. When we start avoiding activities because we're worried that those activities are going to hurt, we begin to decondition after only about 7 days. However, it takes much longer than 7 days to recondition and build that strength back. That's just not very fair at all, but it's true. And it's kind of like the food that tastes the best is the food that's the worst for you. Some things in life just aren't fair, but this is one of them. But the whole idea here is movement is vital. Research backs up the concept as well. Research shows us that those injured workers that get back to their jobs and back to their activities of daily living the quickest are the ones that recover faster and recover more completely. Even if it's just getting back to work in some altered capacity with a decreased workload or with lifting restrictions, they've shown that getting back to a daily routine is not only good for the body, but it's also good for the mind as well. The American College of Physicians now recommends everything that we offer here at Creekstone for back pain of any duration, no matter how long it's been going. If your pain's been lasting for only a few days or a couple of months, or if it's been lasting for 15 years, the American College of Physicians now recommends spinal manipulative therapy and exercise and massage and laser and acupuncture, and now all the medical services that we are bringing in. Here at Creekstone, we are now the first one-stop clinic for everything short of surgery in Amarillo, Texas. We are fully integrated with medical services, and we're now able to treat workers' compensation patients as well as every other patient with the following services, all right here in one clinic. Pain relief. Everybody wants pain relief. That's the biggest issue in the world right now, is low back pain. We offer spinal manipulative therapy, exercise rehab, medical care now, primary medical care. We're offering acupuncture, urgent care appointments, hormone balancing and replacement. That's on its way. Joint injections, trigger point injections. Of course, we offer massage, non-surgical spinal decompression, low-level laser, balance and proprioception training, disc pain relief, relief from radiating pain into your arms and legs, and much, much, much more. We're just scratching the surface right there. As I mentioned, for the entire Amarillo area, we will be the first one-stop clinic for everything short of surgery. And we're so excited to share our services and our expertise with you. It's really going to be something special for our city. If you are an injured worker or you know an injured worker, give us a call at 806-355-3000. Let us get to work helping you get back on the job and back to providing for your family. There's really almost nothing we can't handle now at Creekstone Medical. Again, I'm Dr. Jeff Williams with Creekstone. If you're watching on YouTube, do us a favor, subscribe, comment, and share. If you're seeing us on Facebook, comment, like, and share. It's the way these things work, and we sure would appreciate your help. Your network can benefit from this information, so be sure and help us out. If you're from the Amarillo area or you're passing through and you need to be treated, again, call us at 355-3000. Let's get you on the schedule and help you out. Until next week, take care. We'll see you then.